And I have to stress that it's a very violent shaking. We're not talking about playful shaking with a baby, which, while we may not advise it, we have no evidence that that causes harm. This is a very violent act, and the extent of the violence is such that even were a layperson happened to walk by and observe this while it was in progress, they would, not knowing anything about it, would immediately recognize that this was a very violent act, that this child was being truly assaulted. And so they lose control, and it's usually because of the baby's crying that just gets on the nerves, and they've had it. Sometimes they're not even aware of how much they've lost control with their baby at that point in time. During early development, a baby's head is relatively heavy and the neck muscles are weak. The brain and the connecting tissue are very fragile. That's soft. And I've often used the analogy of a developing baby's brain being like Jell-O. And when the Jell-O is shaken, little slits and tears can occur in the Jell-O. This makes the brain very likely to be severely injured if the baby is shaken. When a baby's head is shaken, the force of the brain moving back and forth, or a sudden impact from being thrown or dropped, may cause the delicate blood vessels between the skull and the brain to tear. This bleeding may occur inside and outside the sections of the brain. This, of course, can result in severe brain damage or even death. If death is avoided, the brain damage may prevent the baby from seeing or walking or talking for the rest of their life. Even the slightest injury can cause permanent brain damage and physical impairment that may not become apparent till later on in life. It only takes one time or just a few seconds to hurt a baby for the rest of its life.
It sounds like these injuries are happening too frequently. Who's responsible?
Well, the principal caretaker, or what we call the primary caretaker, usually mom or dad, or is not uncommon, mom and boyfriend, one of those two tends to be the primary perpetrator most of the time. Certainly it can happen in other places. Anyone that takes care of a child, particularly if they're under stress and have a short fuse and a short temper, can lose it, so to speak. But the most common is either the parents, or a common factor is the mom's boyfriend, not infrequently.
So what are some of the signs or symptoms that a child care provider might look for?
Well, it's an excellent question, because sometimes it can be very hard to recognize, or it may not be recognizable at all. But usually it may present with the child being incredibly irritable or fretful, and the child really being almost unable to be consoled. On the other hand, and the child may be eating poorly, and the child care provider can simply note a drastic change in the way the baby acts. If the child care provider really knows their baby, then when the child comes in and is a marked change of behavior, obviously they can be concerned about it. The findings that may present even more dramatically, the child may have an episode of not breathing. We call it apnea episodes. The child may turn blue, which we call cyanosis. The child may have a seizure. And this type of activity or symptomatology or symptoms might result in the child care provider calling an ambulance or calling help in that sense. So the symptoms can be very subtle. Sometimes the child just appears ill, throwing up, vomiting. A lot of times the child may have a bulging soft spot, a bulging fontanelle, if the baby is less than 9 or 10 months of age and the fontanelle hasn't closed. So that there can be really a wide variation of symptoms, and some of the symptoms may be just simply those symptoms of what you would otherwise suspect to be a sick child, in which case then the child care provider's concern about that would be expressed to the parents or or that sort of thing.
Doctor, you covered a wide range of symptoms here, but they don't all mean that shaken baby syndrome has occurred, do they?
Oh gosh, no, and obviously that can be difficult. The main thing is that the child care provider knows their child, knows their baby, and because other illnesses can have the same symptoms. It is important to know that, and also to know who you will call if the child's ill. If the child suddenly has a seizure or quits breathing or turns blue, then we hope the child care provider will know what to do in those set of circumstances, rendering immediate first aid and calling 911. On the other hand, if the child is ill, is vomiting, is sick, is terribly fretful or fussy, then the child care provider needs to get hold of the parent so that child can have medical care. And indeed, it may be an illness certainly other than shaken babies, because babies, all these symptoms are caused more commonly by things other than shaken baby, thank goodness.
Doctor, child care providers do very rewarding work, but it can also be frustrating sometimes. What do you say to a child care provider that becomes so frustrated they want to act out their frustration with the baby?
Well, certainly that can happen, and babies can cry, and babies can be irritable, and they poop, and they throw up, and they do things sometimes more often than it can get to anybody. And the most important thing is to if you can recognize it yourself that, gee, that baby's really irritating me, take a break, walk out of the room. Even if the baby's still crying, crying won't hurt the baby. Take a deep breath, count to 10, whatever you like to do, you can leave the situation. Then you could come back and perhaps just walk with the baby, walk outside, do something different, just kind of refocus. I think the most important thing is to recognize that the baby's getting to you, and give yourself a break in that situation. If you can, or in an environment where another relative or caretaker or someone else in the home can watch after the baby, why, that's also a reasonable thing to do. But babies can get on people's nerves, and that can happen with anyone. The most important thing is simply to recognize it. But whatever you do, don't shake the baby.
Are there any other resources available for a child care provider that wants to learn more about this?
Oh yes, there are. Certainly you can contact your local child welfare agencies. Additionally, your local child care licensing agencies will have information about this. Many states have available emergency medical services for children programs available, or resource center, which also has information that can be shared.
Dr. Stemke, thank you so much for visiting with us about this important topic, and the staff here at Children's Hospital ER. Thanks so much.
Thank you, David.
Now we turn our attention to fire safety and prevention. By preparing in advance, you can make your family child care home or large child care home safer and ready in case fire breaks out. Major Otis Greenhoward from the Oklahoma City Fire Department spent some time with us to show us how to be prepared for fire. This is Major Greenhoward from the Oklahoma City Fire Department. Major, thanks for joining us. Can you tell us about your role in educating people about fire prevention and fire safety?
Well, David, I've been on the Oklahoma City Fire Department for over 20 years, and currently I'm assigned to the Prevention Office and the Public Education section, where we deal with the public. We go out and educate the public on fire safety issues, and currently I coordinate a program which is called the OKC Fire Smart Kids Club, which deals with child care homes as well as daycare centers, whether it's small or large. And they cater to the pre-K age children. So that's our message to those homes, to make them safe.
Right. We do have some requirements that are available in your requirement books, so you're going to want to be aware of those requirements and be in compliance with them. Can you tell us about some of the considerations of the home and its physical condition that we need to be aware of?
Oh, sure. Proper maintenance of a home, making sure that it's safely wired, as well as not utilizing extension cords as permanent wiring,